Hello, everyone. Thank you all for joining us today for our third-party risk management fundamentals for healthcare webinar that is being hosted by VinMinder in partnership with HIMSS. My name is Abby Clark, and I will be your host. With us today, we have Hillary Dewhurst, VinMinder's head of third-party risk education and advocacy. In this informative session, Hillary will discuss the fundamentals of third-party risk management in the healthcare industry. With that being said, I would like to hand it over to Hillary. Hillary, the floor is yours.
Well, welcome everyone. So today we're going to begin with a brief introduction of third-party risk management, what it is and why it's necessary. And then we'll move on to discuss the actual risks we're trying to manage and why it's so important that we do that. We're going to focus on regulatory and cybersecurity risk in this discussion, but we'll also talk about the other risks that we need to be aware of. We'll introduce you to the third-party risk management lifecycle, and I'll walk you through all the stages and activities, as well as the foundation of the lifecycle. We'll talk about program governance and oversight, and we'll talk about roles and responsibilities. We'll wrap up with some key takeaways, so let's jump into third-party risk management. So to begin, we have to understand what a third party is. The term third party really can refer to any legal entity or individual that provides products or services to your healthcare organization or to its patients. That includes everything from records management to billing to medical supplies, janitorial services, diagnostic equipment, and more. It can also include products or services like consulting, staff augmentation, and marketing. The term third party really does cover all your business relationships. So that brings us to third-party risk management. Well, what is third-party risk management? It is the practice of identifying, assessing, managing, and monitoring all the risks posed to your organization and its patients through those third-party relationships. And I should point out that there is at least some risk in all third-party relationships. Data loss, misuse, poor quality, regulatory violations, poor performance, cost variation, and operational interruptions are all examples of third-party risk. When those risks are unidentified or uncontrolled, it really prevents your organization from getting the full value of the relationship, and they can also interrupt your operations, impact your revenue, violate regulations, and damage your reputation. But most importantly, they can cause negative impacts on your patients' privacy and well-being. So one question that we can anticipate at this point in the presentation is if third-party risk management is the same as other disciplines in your organization, like procurement or supply chain management. This is a really good question because many healthcare organizations do already have supply chain or procurement teams, and those teams may address some aspects of the third-party risk management practice. Let's look at these three disciplines to understand how they're different and where they might overlap. Now, keep in mind, every organization is different, but here are the typical responsibilities for each discipline. So if we start with supply chain management, they're responsible for managing the flow of goods and services and the processes that go into providing finished goods and services that are offered by your organization. And traditionally, they have a focus on areas such as pricing, demand, availability, quality, and service risk. Now, procurement or sourcing is responsible for the identification and selection of vendors. They may be the ones to write the RFP or the RFI, and they often negotiate the vendor contract pricing, service levels, etc. Now, procurement and sourcing often report into supply chain or even finance. But finally, third-party risk management is a very specific risk management discipline that has the direct purpose of assessing, managing, and monitoring risks to your healthcare organization and its patients caused by your third-party relationships. What's important to remember here is that while these three areas are different, they do have overlap as they're all dealing with vendors or third parties. However, third-party risk management is solely built to focus on vendor and third-party risk. And it's a very well-defined practice that includes a required set of activities that all must take place in a specific order. There are very well-established laws, regulations, and best practices for third-party risk management. And as we go through the presentation today, you may recognize some of the activities we discussed as being performed by your supply chain, procurement, information security, or even compliance teams. The good news here is that effective third-party risk management can complement or even be a part of supply chain management, procurement, or compliance. The important thing is that there is a distinct third-party risk management practice within your organization and that it adheres to the regulatory guidelines and best practice and follows the third-party risk management lifecycle. So why is this so important for healthcare organizations today? Well, first of all, and it's true of any industry that's regulated, it's a regulatory requirement. But it's also a best practice that can provide your organization with some very distinct strategic advantages. Most importantly, it's going to help your organization protect your patients' privacy and health. But using third-party risk management can also help your organization make better decisions about which vendors to bring on board. And because your vendors are basically an extension of your organization, third-party risk management can help to improve your organizational cybersecurity profile. But this practice also helps you make sure that you're actually getting the value of the relationship, and it reduces the potential for supply chain interruptions. But more than just being important, it's a necessary practice for every healthcare organization. Why? Well, first and foremost, it's necessary to help protect your patients, not just the loss or misuse of their protected health information, but also to mitigate real health and safety risks that can occur through things like connected medical devices, diagnostic equipment, services, medical supplies, and even pharmaceuticals. Cybersecurity is another really big reason why this is necessary, and we're all aware of the increased cyber attacks on healthcare organizations. So we have an obligation to do what is necessary to reduce or eliminate the frequency and severity of those attacks. Regulatory compliance is a biggie. Surely everyone here knows of HIPAA, which is specific to protecting patients' health information, but there are a lot of other regulations and laws and rules to be considered as well. Finally, waste, fraud, and abuse. These are all terms we're probably familiar with, but by now, third-party risk management is really the best mechanism to prevent waste, fraud, and abuse caused by your external business relationships. So it's important to understand that healthcare organizations have an extremely complex third-party risk management ecosystem. Third parties are instrumental in providing patient care, conducting research, administration, payment processing, insurance management, etc. The fact is that most of our organizations cannot operate without third parties. Now here you'll see three of the categories where we would typically find third parties providing products and services. We have logistics and supplies, which can include categories everything from medical devices to furniture. There is hospital and lab administration, which has all the administrative and medical staff services, visitor access management, security, payment processing, billing and collections, and even service workers for food, laundry, housekeeping, sanitation, janitorial, etc. But then we need to consider our facilities, and it's not just hospitals and clinics, but also nursing facilities, assisted living residences, and even research sites and labs. So there's a lot here. And unfortunately, this isn't even a comprehensive list, but it's a good representation of all the different products and services that healthcare organizations need to provide care for their patients. And the list illustrates the sheer number of third-party or vendor relationships present for any healthcare organization. As you can see, the more vendors we have, the more risk we need to manage. So what are the risks we're trying to manage? Well, there are a lot of them, but let's look at some of the most common risks we see associated with third parties. First, we have operational risk, which exists anytime you have a dependency on a vendor or a third party to provide a product or service that's essential to your day-to-day operations or to your patient's care. Operational risk is pretty broad and includes other risks like business continuity and disaster recovery risk. We also have regulatory and compliance risk, which is a huge issue within the healthcare industry. Regulatory and compliance risk happens when a third party fails to comply with any regulatory guideline or law, or fails to follow your organization's internal policies, business codes, and standards. And somewhat like operational risk, this is a pretty broad category. So for example, failure to secure patient PHI is not only a cybersecurity risk, but it's also a compliance risk. In speaking of cybersecurity risk, this is huge, as we're going to talk about this in more detail today. But as an overview, cybersecurity risk is that risk of data breaches, ransomware, identity theft, etc. And it's the risk of improperly disclosing or using PHI through negligence or willful disregard for information security protection. That security protection might include physical security, just restricted areas, or leaving information unattended on a computer. It could be improperly storing or disposing hard copy files, etc. Now, there's a lot of financial risk involved, both for the patient and for the organization. For the patient, it could come in the form of higher charges for service due to waste and abuse, but it can also come in the form of identity theft, which can certainly impact the individual. But unidentified or unmanaged third-party risk can cause your organization to lose revenue or have a lot of unplanned costs, such as higher insurance premiums, legal settlements, and fines. And finally, that brings us to reputational risk, which is really a byproduct of all unmanaged third-party risk. And it can exist literally anywhere when you use a third party. Basically, your patients, the regulators, and the general public, they don't make a distinction between something you did wrong and something your third party did wrong. So as we say in third-party risk management, you can outsource the activity or the product or the service, but you can never outsource the risk. So it's important to remember that no matter what kind of vendor risk we're talking about, your organization is responsible for identifying those risks and managing them. Now, two of the biggest areas of concerns for third-party in healthcare are compliance and cybersecurity. So we're going to focus in on those for a little bit. Let's begin with compliance. We're going to discuss HIPAA, or the Health Insurance Portability and Accountability Act, that was established in 1996. It was basically designed to protect sensitive patient health information, and the Health and Human Services Office for Civil Rights actually enforces HIPAA rules. So if there's any violation, organizations can expect either civil or monetary fines or even criminal penalties, depending on how bad the situation is. Now, the first part of HIPAA involves the HIPAA privacy rule, and this standard governs how all entities are allowed to use and disclose protected health information. It's also about making sure that individuals have the right to understand and control how that medical information, or PHI, is used. There's a subsection of HIPAA, which is the HIPAA security rule, which specifically addresses electronic protected health information. So in general, HIPAA covers all health information, no matter what the format, whether it's an electronic record, an X-ray, physician's notes, or even prescriptions. The security rule requires that covered entities ensure the confidentiality, integrity, and availability of all electronic PHI, and requires that organizations and their business associates have appropriate safeguards to protect the security of that information. The rule also addresses permissible use of that data and requires healthcare organizations and their vendors to certify compliance in their workforce. So, yep, HIPAA is very comprehensive in its requirements about how to protect PHI and electronic PHI. So that might bring us to the next question about what is considered PHI. Now, under HIPAA, there are 18 different categories of protected health information. And keep in mind, it doesn't have to be a combination of all 18 to constitute PHI. PHI can be any one or any combination of the information types listed here, which might include name, address, dates, birth dates, death, admissions, or discharge dates. It covers all of your contact information, including your social security number, your medical record number, and your health plan information. And that includes who your beneficiary is. It covers your medical device identifiers and serial numbers. It covers biometric identifiers like fingerprints, full face videos and photos, and any other uniquely identifying numbers, characteristics, or codes. So essentially, pretty much everything is covered under protected health information. So the next question is, who is responsible for protecting this information? Now, you'll see that we have 4 categories here. We have healthcare providers, health plans, healthcare clearinghouses, and you guessed it, business associates. Now, business associates are those third parties and vendors that actually need to access, process, transmit, or store PHI as part of the service that they provide to you. So now we know who's responsible for it, but what is a business associate? So when we talk about what a third party is, now it's important to keep in mind that many organizations use different names for their third party relationships, whether that's a vendor, a supplier, a provider, or a business associate. But when we come to a business associate, it's very specific. It really addresses just those vendors that need to touch that PHI. Another important regulatory item that you must pay attention to is the General Exclusions Program. This requirement is enforced by the Office of the Inspector General of Health and Human Services, and it prohibits organizations from doing business with any excluded or sanctioned individuals or entities. There are multiple exclusions and sanctions lists. Individuals and organizations can be excluded if they've been convicted of Medicare or Medicaid fraud, meaning that they cannot be reimbursed for any goods or services they furnish, order, or prescribe. So suppose a healthcare provider arranges or contracts by employment or otherwise with a person or entity that the provider knows or should know is excluded by OIG. In that case, the provider may be subject to civil monetary penalties and has liability if the excluded person provides services payable directly or indirectly by a federal healthcare program. There are also government sanctions and prohibitions against entire countries, organizations, and specific individuals. So it's really important to ensure that any third-party vendor or business associate that your organization is using is not on any sanctions or exclusions list. Now, while we've touched on 2 really important regulations here, keep in mind that there are many more healthcare regulations that we need to comply with. And as it goes, so do our vendors and business associates. Now let's turn our attention to another major risk that we're trying to navigate, and that's cybersecurity. I'm not going to go into all of the healthcare data breaches that have happened in the last few years because it is nearly impossible to read the news without hearing about yet another healthcare data breach. But here are some quick facts to consider when we're thinking about cybersecurity. First of all, according to IBM's Cost of a Data Breach report, the average cost of a healthcare data breach is now $10.1 million. And one of the reasons that there are so many healthcare breaches is because healthcare records, or PHI, has an incredibly high value on the dark web. Hackers can sell that data for approximately $250 to $400 a record. Now, to compare that, let's say someone stole your bank records, those are only worth about $200. Stolen healthcare records are very profitable for hackers. And when these records are stolen, they can be used for any number of fraudulent activities, including purchasing prescriptions, receiving treatments, or even making false medical claims. That means that your patients are going to experience real financial impact as well as health impacts. So let's imagine the patient who can't get reimbursed from their insurance company because there's fraud on their account, or there's an identity theft that leads to credit issues, or maybe they're being billed for services that they did not receive. Anyone who's ever had their identity stolen can tell you just how horrible that is. But the thefts in healthcare are very serious issues. Just beyond having compromised data, cyber attacks can be a real threat to patient care and safety. So, for example, if hospitals can't access electronic records or are delaying operations or diverting ambulances, that's a very serious problem. Let's imagine the cancer patient who has to delay essential treatment because of a data breach or a maliciously down system. That clearly increases the risk of a negative medical outcome or even death. So while being interconnected has made it all so much easier to deliver effective medical care for our patients, it's also created many access points for data breaches, cyber attacks, data theft, and fraud. Patients, of course, should be the #1 priority, but don't forget there's real financial implications to your organization if you can't secure that PHI. And they can run from regulatory fines to civil and criminal penalties. And it's really no joke. The amount of business associates facing cyber attacks has increased 337% since 2018. And that's according to the HIPAA healthcare data breach report. So we can take that number very seriously. And speaking of business associates, the HIPAA Journal reported earlier this year that of the healthcare data breaches in 2022, more than half of them, or 56%, were caused by business associates. And this makes a lot of sense because as organizations continue to outsource and there are more products and services delivered, the number of vendors goes up, and so the risk multiplies. And it's also because hackers are not stupid. They are increasingly targeting business associates because they frequently have inadequate cybersecurity controls. They may need only one successful cyber attack to access the systems of all the vendor's clients. So going after an organization's business associates is often the best way in. And that's why third-party risk management is one of the biggest challenges healthcare organizations are facing today. So we've talked a little bit about what third-party risk management is and some of the risks that we're trying to manage, and we've explored some of the regulatory requirements as well as the impacts that happen from cyber attacks and breaches. But the big question here is, what can healthcare organizations do to reduce their risk related to these relationships? And the answer is just really straightforward. It is by having a practice of third-party risk management. So for those that have experience in healthcare organizations but may be new to third-party risk management, I can make a really good comparison between the proactive healthcare model and third-party risk management. So in healthcare, the proactive care model is the process of evaluating a patient's baseline health and identifying all their risk factors. Then implement preventative habits or treatments into their daily lives to prevent, delay, or minimize illness and disease. The patient is monitored regularly to look for any small changes to their health so it can be addressed before it becomes a crisis. In a very similar fashion, third-party risk management helps to protect your organization by identifying the risk factors, implementing controls, and continuously monitoring them. This practice helps your organization identify and treat those vendor risks before they become very big issues. So proactive care is actually a great blueprint for third-party risk management. And we're going to keep our eye on them so they don't become big problems. So all in all, the proactive healthcare model is a great blueprint for third-party risk management. As we go on today, I want to acknowledge that third-party risk management is a very complex practice, and it's full of interdependent and interrelated processes and stakeholders. And we can't cover everything in great detail today. But what I want to go through with you are those fundamentals, the third-party risk management lifecycle, some basic program governance and oversight, and some roles and responsibilities that every organization should have. Now, before we get into all the rules and requirements that make up third-party risk management, there's a very important principle to follow to make sure that your process is always effective and efficient, and that is the principle of proportionality. That means that everything in your program is risk-based. The higher the risk of the engagement or the vendor relationship, the more thorough your activities must be. So, for example, if you have a business associate who has access to PHI, you're going to have to do a very thorough review of all their cybersecurity and information practices. You're going to have to look at their financial health and ask for proof that they comply with the applicable regulations. On the other hand, if you have a vendor who's selling office supplies, well, that risk is much lower, and therefore it's acceptable to have a very limited scope of due diligence, and you really don't need to monitor them as frequently. And this principle is really important because your program cannot perform effectively if you're treating every vendor the same. Risk-based programs allow you and your organization to focus and prioritize the highest risks and manage them appropriately. So now it's time to introduce you to something called the third-party risk management lifecycle. The third-party risk management lifecycle was originally developed by financial regulators a couple of decades ago, and it was meant to identify all the points of risk identification, assessment, and management that need to take place throughout the vendor relationship. I want to point a few things out about the lifecycle. First, you'll notice that it's broken into 3 distinct stages, which are onboarding, ongoing, and offboarding. And within each stage, there are individual activities that must occur within a specific order. We're constantly identifying and assessing and managing risks all along the way, but how we do that might differ slightly depending on which stage of the life cycle we're in. You also should notice that the life cycle has a foundation of governance, which consists of oversight and accountability, documentation and reporting, and independent reviews. Even though it's very simple, the third-party risk management lifecycle is an incredibly valuable tool because it provides a clear roadmap of how to engage and manage your vendors throughout the relationship. Now, the first stage of the life cycle is the onboarding stage, and this really covers everything from the time you identify that you need a vendor right up until you execute the contract. It's often said that onboarding is the most important stage of the life cycle because you're setting that relationship up for success or failure right from the beginning. So what do we do in onboarding? Well, first of all, we have to plan for the relationship. That means that we can clearly articulate the need for that vendor and that we identify the anticipated benefits of the relationship. It's really important because if we don't know what the vendor is supposed to provide or how they're supposed to add value, then the vendor won't know that either, which can create a lot of confusion down the line, especially when it comes to performance. It's also incredibly important that for every vendor, there is a vendor owner. The vendor owner is the person that is responsible for identifying the vendor risks throughout the relationship and managing it. That person is also responsible for adhering to all the requirements within the third-party risk management framework. And they're responsible for monitoring and managing the vendor's risk and performance. This is a really important responsibility. And so the responsible party must have the skill, experience, and bandwidth to perform their third-party risk management duties. And this is where some organizations run into trouble because they either have no vendor owners assigned or the ones that are really don't have the right mix of skills and time to execute their responsibilities. Once we've planned for that relationship, the next step is to determine the types and amounts of risks that we need to manage. And this is done through something called an inherent risk assessment. This is an internal assessment that identifies the types and amounts of risk present before we consider any potential risk mitigation controls. It's through this process that we establish the risk rating or level of that vendor engagement. And this is a really essential first step because that risk rating will help you identify the level of intensity for your third-party risk management activities and help you determine the scope of due diligence that you must perform on the vendor. Another really important aspect of the risk assessment stage is determining if the vendor is going to be critical to your operations. A critical vendor is one that should they fail or have a prolonged outage, it would be impossible for your organization to conduct business or as usual or even at all. On the scale of least to most important, your critical vendors are going to require the absolute highest amount of third-party rigor and management. So it's really important to know who they are. Knowing the risk and criticality of any vendor paves the way for appropriate risk-based due diligence, and it determines the frequency and intensity of third-party risk management activities throughout the life of the vendor relationship. It's also very important to make sure these assessments are done before signing any contracts. This brings us to the due diligence stage. Due diligence is one of the most important processes we have in our third-party risk management practice. And chances are that your organization is already doing at least some due diligence for those business associate relationships where they have access to PHI. But in all actuality, the highest risk vendors or business associates are going to present more than one type of risk. Due diligence really serves 2 purposes. First, it's going to help you confirm that you're dealing with a legal business entity and that they have a good reputation. The other main function of due diligence is to review and evaluate the vendor's risk management practices and controls so that we can determine as an organization that those controls are suitable before we enter a business relationship with them. And since we're entrusting our vendors to provide important products and service, we need to verify that they are really equipped to do that. A key takeaway here is that due diligence is not only just gathering all this information, but it's really looking before you leap. And it's not just a best practice, but it's a regulatory requirement. And frankly, it just makes good business sense. Remember, when you sign a contract with a vendor, you're as good as vouching for them. So let's take a little bit closer look at due diligence. The process involves a couple of steps. The first of which is the vendor risk questionnaire or due diligence questionnaire. This is something provided to the vendor from the organization that the vendor must complete. And it's usually quite detailed and asks many questions about the vendor's management practices and controls. Now, the vendor must also provide documented evidence of these risk practices and controls. And your organization is going to use both the risk questionnaire and their documented evidence to determine if they do have the controls in place. Those documents are often referred to as due diligence documents. So what kind of documentation should we be asking for? Well, from a cybersecurity perspective, we're going to want to review all their high trust certification or SOC documents or other independently certified reports and audits and credentials. We'd need to review their business continuity and resumption plans, their financial health, and most importantly, evidence of compliance to regulations like HIPAA. Due diligence also involves reviewing your vendor's internal policies and practice, such as background checks for their employees and compliance training. During due diligence, we also want the vendors to disclose any of their vendors that play an essential part in delivering products and services to our organization. And we call these fourth parties or nth parties. More simply, these are the vendors of your vendors. And many healthcare products and services have a pretty long supply chain. So it's really important to know who those fourth parties are and how they're being managed by your vendor. Your organization also has the obligation to review your vendor's insurance. You need to know that they have the right types and amounts of insurance. And it's very important to the whole process, as we mentioned before, to make sure that these vendors are not on any sanctions list. Once all this information is gathered, subject matter experts in each risk discipline will need to review the provided information and documents to determine that, yes, the vendors do have the appropriate risk practices and controls. If not, then your organization will need to work with the vendor to either correct the issues before you can sign a contract or just simply decline the relationship. At the conclusion due diligence, you should have all the information you need to really put together a solid contract. And contracts are really one of the most important risk management tools that we have because they legally obligate that vendor to adhere to specific risk practices, to have the right level of insurance, and to allow your organization to audit them. Your contract may also include service level agreements, which represent the most essential aspects of performance. Many contracts also include some sort of penalty for the vendor if those service level agreements are not met. It's absolutely imperative that your due diligence is completed before you sign the contract. If you don't do this and you find something pops up in due diligence post-contract execution, you basically have no leverage to compel the vendor to remediate the issue, and your organization will be saddled with unnecessary risk. Once the contract is signed, we enter the ongoing stage or the business as usual stage. And this is where most of us are with our vendors at any given time. But just because we've gotten through onboarding doesn't mean that we're still not concerned about risk and performance. In fact, the opposite is true. During the onboarding stage, the ongoing stage, we're constantly monitoring risk and performance, and we're periodically reevaluating that risk and refreshing our due diligence. So let's take a look at how this works. One of the first things is risk reassessment. Now, even though you've performed rigorous due diligence on your vendor at a certain point before signing the contract, it's important to realize that vendor risk levels and profiles can change. And that due diligence only represents what was going on at a certain point in time. There's many internal and external factors that can affect the risk level of your vendors, such as mergers, acquisitions, change in management, declining finances, expansion of products or services, or even industry changes. But there's other events and circumstances such as lawsuits, data breaches, or cyber attacks that can also change your vendor's risk profile. This is the reason that we have to periodically reassess the risk and look for any new or any changing or emerging risks and deal with them appropriately. This is the risk reassessment process, and it's recommended for your most elevated risk vendors, such as your high risk or critical, that you're doing this at least once a year. As part of this process, we also ask the vendor to review their questionnaire and update it if necessary, and to provide the most current version of their due diligence document. Now, when we get to due diligence documents, we need to make sure that we have the most current documents on file. It's important to remember that there are documents like third-party audits, like a SOC 2 Type 2 report, or insurance certificates that do expire. So it's your organization's responsibility to stay on top of that. We also want to collect these documents periodically to make sure that they're actually living documents. So, for example, if we see that they haven't reviewed their information security policy in 3 years, that might be a red flag we want to address with the vendor. Again, this needs to happen at least once a year for your highest risk vendors, but it can also happen before you sign any contracts, or if there's any significant service changes or there's been regulatory changes. So those periodic risk assessments, those formal reassessments and due diligence reviews are a really important part of your third-party risk management practice. But as I mentioned, risk can always change. So in addition to those formal periodic risk assessments and due diligence, your organization must constantly monitor and manage the risks that evolve. So that means keeping your eyes open for negative news about the vendor or being aware of any industry changes, et cetera. Again, you can think about this process as being similar to that proactive healthcare model. We just want to keep our eyes on what's going on so that if there's small changes, like say a slight decline in performance, that they can be addressed before they become big problems. When it comes to performance, we want to ensure that they are delivering the expected quality and service at the right price and that they're meeting all their service level agreements. But we also want to continuously ask the question, is the vendor delivering the anticipated value to the organization, and are the risks balanced by the cost and the benefit? Finally, in ongoing, another essential element is the contract renewal. So if everything is going well and all your expectations are being met, you might want to renew the contract. But first of all, we need to validate that, yes, in fact, we are going to do that. Now, this means that we've given ourselves enough time to really review the contract in its current state and identify any changes or additions that we'd like to make. A good rule of thumb here is that a formal contract review should happen midway through the contract term. At that point, you should be well able to determine if the contract needs to be renegotiated, amended, or ended. When we come to the negotiating table, we need to do so in an organized way and ensure that we do have enough time to negotiate. But even if we choose not to renew the contract, we still need to review and identify any contractual obligations related to contract termination, such as notification periods or fees for early termination. Now, everything has to end sometime, and when your vendor relationship ends, they're no different. That's when we move into the offboarding stage. However, we need to ensure that no matter why the relationship is ending, that we're prepared for it and that we have a good plan in place. The offboarding stage is very important because there's a lot of risk involved in poorly executed contract terminations and offboarding. So let's look at these 3 steps in the offboarding stage. So the first one is termination. Once we've decided we cannot renew a contract or that we need to preemptively terminate a contract, we need to notify the vendor. But it's really important to read and understand your contract first so that you can identify and consider any restrictions or requirements about that contract termination. For example, most contracts will have a notification date or requirement around the length of time before the contract terminates to notify your vendor. For example, you might be required to notify the vendor 90 days before contract termination. There may also be formalized requirements about how that notification is received and who it must go to. But once you've notified the vendor of termination, you really need to begin your exit plan execution. Now, when it comes to exit plans, your organization should already have a strategy for what they're going to do when that vendor relationship ends. Are we going to move that to another vendor? Are we going to bring some of that work in-house? Or are we just going to stop doing the activity altogether? Your termination strategy identifies what you will do, but your exit plan identifies how you will do that. So it's really important with your exit plan to outline all the responsibilities of both the vendor and your organization so that you can safely and securely close down the relationship. And it can include things like making sure you get sensitive data back or ensure that it's destroyed. You'll need to revoke all the access to your networks, data, and facilities. And at the closure of the exit process, the last step is that administrative process, or that TPRM closure. Now, this is a lot of administrative stuff, but it's still absolutely essential because we want to make sure that we're reviewing any remaining invoices and checking them very thoroughly before we pay them. We also want to inform our accounts payable department not to pay any invoices after the last approved invoice. And we also want to update our records of the third party in any system where they exist. So that could be AP, a supply chain or procurement system, contracting, etc. Most importantly, we want to update the record in our third party risk management system. And we need to make sure that all the vendor records are appropriately organized and archived in the event that we need them later. So maybe for an audit or an exam. We also need to retain those vendor records per the organization's record retention policy. So now that we've talked a little bit about the life cycle, I want to get into some key roles and responsibilities in third-party risk management. Now, as I mentioned before, this practice has really evolved in the financial service industry, and there have been official rules and requirements for about 30 years. However, for healthcare, it's really a different story because this practice is still evolving. But third-party risk management may be limited to ID departments that are assessing business associates and ensuring that they're compliant with HIPAA. But as we discussed, all the possible third-party risk, compliance, and cybersecurity, they're only part of the total risk environment that needs to be managed. So there are specific roles and responsibilities that should be assigned in every organization. And it's really not important what you choose to call these, the titles you give these roles, as much as it is important that they are clearly assigned. So let's take a look at what those roles are. We're going to start with the vendor owner because this is really where the rubber hits the road. These are the folks that own that vendor relationship and all the risks that come with it. They're responsible for that vendor from start to finish. And they must follow the guidelines and requirements as dictated by the organization's third-party risk management policy and team. In healthcare, it's very typical that the title of risk manager may take on these responsibilities. But their primary responsibilities are first to identify the risk in the product and service, and they do that by completing the inherent risk assessment. They need to prepare the vendor for the due diligence process, which might mean that they ensure that the vendor can log on to the system, that they are returning the requested materials on time. And if there's any issues that are discovered during due diligence, it's the vendor owner's responsibility to make sure they are successfully remediated before the contract happens. But once that contract is executed, then they're responsible for managing that vendor's risk and performance and making sure that they're meeting all contractual requirements and best practices. They need to monitor that vendor risk profile by keeping their eyes open to negative news, industry changes, etc. It's the fundamental responsibility of the vendor owner to make sure that any vendor issue is addressed effectively and on time. And depending on your organization, they may have some other responsibilities on their plate. But ultimately, these responsibilities for a single vendor should sit with a single person versus being spread across multiple people or departments. Now we come to the third-party risk management team or individual. And these are the folks who are responsible for all the elements of the third-party risk management framework. And this includes the policy, the rules, tools, and requirements that make third-party risk management possible at your organization. They need to design and implement this framework and then maintain it to make sure that third-party risk management is an effective practice. They are responsible for understanding and integrating the regulatory requirements and best practices, and they need to monitor vendor owner deliverables to make sure that they're accurate and on time. They also act as air traffic control to formally facilitate the third-party risk management lifecycle, so moving from one stage to another. They establish the cadence for all the risk, due diligence, performing monitoring, et cetera. This team is also responsible for creating and distributing reporting to senior management, committees, risk committees, and the board. If there's an audit, they are going to be on point for responding to any specific document requests, interviews, et cetera, regarding third-party risk management. And just like the vendor owners, they may have different roles and titles in your organization. It could be they're part of the enterprise risk team or a general risk and compliance team. However, that doesn't matter. What does matter is it's important to make sure that there is a consolidated accountability and responsibility for these activities in your healthcare organization. Another really important role in the third-party risk management world is that of the subject matter expert, or as we call them, the SMEs. And SMEs are responsible for that formal review and analysis of the vendor's risk management practices and controls. They need to provide a qualified opinion on the sufficiency of those controls and make recommendation to the organization as to whether it's safe to proceed with the relationship. Really important to remember that not just anybody can be an SME. You know, Frank in accounting might be great at troubleshooting things on the desktop, but he's not really qualified to review a vendor's cybersecurity controls. Remember, doing these reviews requires a lot of professional skill and expertise, and subject matter experts should have professional credentials and certifications for the risk domains that they're reviewing. It's important, for example, that a qualified cybersecurity expert is reviewing those controls that are going to help prevent data breaches. And subject matter experts' responsibilities include reviewing the questionnaire and the documents provided by the vendor, but they also should be providing a documented assessment and recommendations related to that review. They also can consult with the vendor owner and third-party risk management if there's any issues and help to identify the required remediation. Subject matter experts also have another role outside of risk reviews, and that's to consult with third-party risk management to develop those risk questionnaires and identify the due diligence documents requirements. Now, I want to jump into oversight and governance, and it's really important to understand that oversight and governance really starts at the very top with your board of directors. Now, I do realize that there are organizations that don't have a board of directors, and if you do not, then these responsibilities really default to your senior management. So let's take a look at what the board is responsible for. The board is responsible for not only ensuring that there's compliance to all laws, rules, and regulations, but that there's also an acceptable level of risk associated with their third-party relationships. They're really setting that tone from the top by ensuring the consideration of vendor risk and vendor risk management is incorporated into the organization's strategy and business decisions. Their responsibilities include approving the third-party risk management policy, reviewing ongoing monitoring results for any critical vendors or activities, and the board needs to review the results of any internal or external audit or regulatory exam. They also must be responsible for ensuring that senior management has provided adequate resources to effectively manage third-party risk across the organization. Now, speaking of senior management, They are responsible and accountable for the execution of third-party risk management processes across the organization. That means that they are responsible for making sure that the activities are appropriate and in scale with the presented risk, and that they are effective. Senior management is also responsible for setting that tone from the top and making sure and communicating that third-party risk management is a priority. They need to be sure that there are adequate resources in terms of skilled and competent people, that they're subject matter experts, and that there's the right technology and tools to manage these processes effectively. They also need to review and approve the third-party risk management policy and synthesize that third-party risk management data and reporting into the business decisions and activities. Senior management also must have a comprehensive view of how the third-party risk management framework operates. But most importantly, senior management is responsible for addressing any issues or concerns in an effective and timely manner. And that means enforcing policy and addressing with folks who are non-compliant. That brings us to internal audit, which is very important. Auditors have a really important responsibility because they are on point to ensure that the organization is complying with all the laws and regulations, that the third-party risk management processes are effective, and that everyone is held accountable. So if there are any gaps or issues, the auditors must determine where the failure points are and identify who is on point to fix them. They are always there to ensure that there's appropriate responsibility and accountability across the third-party risk management practice and processes. Audit will report their findings to senior management and the board of directors. And even though a lot of us hear the word audit and panic just a little, the truth is that audits are a really necessary part of a healthy business process. An audit is supposed to help us identify and close those issues before we ever get to a regulatory exam. And speaking of regulatory exam, let's talk about those auditors. So those regulators, they have examiners, they come in and they look at the program just like the auditors. And while regulators do a lot of things, they're primarily responsible for setting these requirements and guidelines that constitute safe and sound business practices. They're also responsible for compelling transparency, monitoring the performance and compliance of organizations to those requirements. They conduct audits and investigations, and when it's determined that something is wrong, they carry out enforcement actions. So as we bring our presentation to a close today, I want to summarize some of the components for a successful third-party risk management program. First and foremost, your organization needs to have a strong understanding of regulatory requirements and best practices because you need to know the standards to which you're managing your vendors. Your program needs to be risk-based, which means that your efforts are in scale to the risk presented. And you need to follow the third-party risk management lifecycle as it's the best roadmap to make sure we're comprehensively managing the risk throughout the relationship. There's a need for clear roles and responsibilities, and we want to make sure that core activities are accomplished and that people are held accountable for effective third-party risk management execution. Standardized tools and processes are going to help make your program a lot more efficient and comprehensive. Let's not forget that we have to have skilled people to perform these activities and that they need sufficient resources. Maybe that's in terms of budget or technology, tools, etc. And oversight and governance are key to making sure the program runs as intended. And as much as we may not like them, independent reviews like audits and exams are just a necessary part of a healthy business. As we bring the presentation to a close today, I want to talk about some key takeaways. Most importantly, third-party risk management is an absolute necessity for all healthcare organizations. Clear roles and responsibilities within the organization are essential to make sure that the process is executed effectively and efficiently. We can't forget that third-party risk management program and activity should be risk-based. And of course, cybersecurity and regulatory compliance are top concerns, but we can't forget about all the other risks that can really impact our organization or its patients. As part of both cybersecurity and regulatory compliance, we need to know who our business associates are. But remember, not every third party is a business associate. That's really only those who access, process, transmit, or store PHI as part of the product or service they're delivering to the organization or to the patient. Following that third-party risk management lifecycle is absolutely essential, as it's going to help you make sure that the right processes and activities are taking place and in the right sequence. We also need to realize that risk assessments and due diligence are not one and done activities, because third-party risk management, the risk changes all the time. So we need to make sure we're periodically checking in and reassessing that risk and performing those risk reviews, collecting the due diligence. And we have to do that throughout the life of the relationship. Another important consideration is to remember that your organization, your contract is one of the best tools that you have to help you with those risk management processes. And it's essential to structure your legal agreements to incentivize the right management and risk management behaviors. Managing vendor performance not only helps your organization get the real value out of the relationship, but it's essential for identifying those small problems and dealing with them before they become huge issues. Finally, third-party risk management, oversight, and governance always begins at the top, and it starts with your board of director and cascades down through senior management and throughout the organization. If the board and senior management are not clearly communicating a commitment to third-party risk management, it's unlikely that it will be successful in the organization. Thank you, everyone, for your time and attention today. And now I'll turn it back over to Abby.
Great. Thanks so much, Hillary. On your screen now, you will see a link to our webinars library, vinminder.com/webinar. We invite you to check out both upcoming sessions and sessions you can view on demand. If any third-party risk questions come up from watching webinars or just in your daily work, post them inside of our third-party think tank, an online community that is dedicated to third-party risk professionals and free to join at thirdpartythinktank.com. In the community, you'll also find thousands of free educational resources related to third-party risk management topics to assist you. If you'd like to become a member of the third-party think tank, you can register on the site or shoot us an email and we'll get you registered and send a link to set your password. In addition, we wanted to call out some particular resources that we think you may find valuable. The first one is our 7th annual State of Third-Party Risk Management 2023 white paper that provides insight into how organizations manage third-party risk today. It provides an in-depth look at current practices, challenges, compliance incentives, and third-party risk management benefits. We surveyed individuals from a wide variety of organizations and industries, including healthcare, and from a variety of organization sizes. It's truly jam-packed, covering many topics. Also in this list, you'll see healthcare-specific resources we highly recommend checking out. To wrap up, I would like to thank Hillary for her time and sharing some really important information. Today, you learned an introduction to third-party risk management, what it is and why it is necessary, as well as what risks you should be managing and why. After that, we took a look at the third-party risk management lifecycle stages, activities, foundation, and considerations. Next, we covered program oversight and governance roles and responsibilities and wrapped up with key takeaways. We would like to thank you all for attending and hope you found today's session valuable. On behalf of VinMinder and HIMSS, it has been a pleasure. Thank you and have a great rest of your day.